Flu season in the United States traditionally starts in the fall and ends in April. In a normal year, tens of thousands of Americans, including children, die of influenza. But this has not been a normal year.
There was very little to no influenza this year. It was in many ways a historically quiet and uneventful flu season.
The CDC reported about 2,000 cases of influenza in the U.S. from late September to April. In a normal year, the average is over 206,000 cases. There were about 600 flu-related deaths. There were also big reductions in other illnesses like RSV, a virus that is a leading cause of pneumonia in infants. The drop in respiratory diseases was reported all around the globe. Experts say measures taken during the pandemic, including school and business closures, increased hand washing, social distancing, and masks, also helped stop the spread of these other viruses. But data indicates more people got the flu shot this season amid concerns of a so-called twindemic that could further overwhelm hospitals dealing with COVID-19 patients. In September, the World Health Organization said there was a shortage of flu vaccine.
Yes, there has in fact been an increased demand, and we're hearing now that countries that are trying to get influenza vaccine cannot get it.
Life is starting to return to normal in some parts of the world, and the flu is certain to reemerge. There is some concern that outbreaks could be more widespread because there's been less exposure to the virus this year. Dr. Long highly advises getting a flu shot later this year.
There's really no benefit to exposing yourself to the dangers of natural infection when a good vaccine exists. You never know if you are going to be the unlucky individual who has a severe infection from one of these illnesses.
A lot has been learned over the past year about how to stop infectious respiratory diseases from spreading. Masks are one part of the puzzle. In Asia, mask usage is common, but in the United States, it was totally foreign until the pandemic. Long believes habits could change.
I think there will be some changes in behavior. I think some people may continue to wear masks when they're on planes or when they're during respiratory virus season, when they're in crowded areas.
Clinical trials indicate many COVID-19 vaccines are highly effective in preventing infection. Flu vaccines are less capable. For those who want an extra layer of protection come flu season, you may want to mask up when it gets chilly. Karina, CGTN.